Okay, basically.
Ready to go? So, Dr. Edgel, I want to talk about stroke just at the very beginning. Um, why is it so important with this phrase "time is brain"? Why is every second count when it comes to stroke?
Yes, well, I think many people don't realize how sensitive the brain is to a lack of blood flow. And what a stroke is a blockage in one of the blood vessels, taking blood to the brain, carrying oxygen along with it. And as soon as that blood flow is halted by a blood clot, generally speaking, the brain tissue that normally is supplied by that blood starts to melt away, and it's very, very rapid. There's no organ in the body that's as sensitive to a lack of blood flow. So almost 2 million brain cells are dying every minute that the blood flow is cut off. And so that's why getting to the hospital and getting that artery open again and the blood flowing quickly is so essential, because every minute your brain is melting bit by bit.
And traditionally, the method of doing that was TPA. Can you explain? Are you good?
Yeah, I was checking for
What is TPA, and
Sure.
how do neurologists use that?
Well, TPA is an interesting medication. It's actually a naturally occurring substance in the body, and its role is to dissolve blood clots. And so what we did in medicine is replicate that natural substance and concentrate it as a medicine, so that when somebody has a stroke, which is usually caused by a blood clot lodged in one of the arteries, we can give that TPA, that concentrated clot dissolving medication, through the vein. That then allows that blood clot to become softer and hopefully dissolve completely. And that's very effective in some stroke patients where the clot is small enough that the medication can attack it effectively and dissolve it. It's not so good in patients with very large strokes where the blood clot is very large and the medication isn't sufficient.
And now you have another option. You've been using it for a couple of years. Talk about the retrievable stent.
Yeah, so it's very interesting. I mean, TPA for almost 20 years now has been our one treatment that we can give to patients who are actively having a stroke, and that's within the first 3 hours, typically speaking, sometimes out to 4.5 hours. However, now, just a few months ago, we have a second treatment for those patients, and not only is it a second treatment, but it's a treatment that's particularly effective for the most severe strokes, and that is the retrievable stent. And that is a device which consists of a metal cylinder. It's made out of a wire mesh, and it's attached to a wire. And that cylinder can be carefully guided through a minimally invasive procedure up through the body into the brain artery where the clot is lodged. And once it's there, it opens up and traps the clot within that cylinder. And then we can pull both the cylinder and the clot out of the body, very rapidly restore blood flow, and improve the outcome in patients who otherwise would have deadly or disabling strokes.
The New England Journal of Medicine study. Talk about that.
So this is the study which really opened the door and showed us that these devices are so effective. It was published toward the end of 2014, and it was done in Amsterdam in the Netherlands, and there they were able to study over 500 patients and either give them the clot dissolving medicine, TPA, or give them both the clot dissolving medicine and use these new devices, the retrievable stents. And when you compare those two treatments, either the TPA alone or adding the stent technology, it turns out that people who got the stent technology did a lot better. They had almost a 70% greater chance of being functionally recovering at 90 days, which is a huge difference. And it's opened up this whole treatment arena and likely will make that part of our standard armamentarium in the future.
And that's what I want to.
Just bring it a little bit further down so you can get something like that too. Okay.
So, what's the future for stroke then? And going back to your point, I mean, these are exciting findings. Do you think this is going to be used more regularly by folks like yourself moving forward?
Absolutely. I think this is going to be a transformative moment in how we treat stroke. We know that it's a very time-sensitive disease, but when your treatment options are limited, it's hard to really mobilize people and motivate people to get to the hospital and seek care. But now we have two very powerful treatments that can halt and in some cases reverse stroke symptoms, and I think that will motivate people hopefully to get to medical attention more often and more quickly. It should also motivate hospitals to design systems to really get people this treatment in a timely manner. And we, as those who do those procedures, will have to do them more effectively and more quickly and more often.
Is time still a factor? I mean, that's the thing you really, maybe for the average person, they need to know that if they're seeing these symptoms, they need to get to an emergency department right away or call 911 right away, really. But even with the retrievable stent, time is of the essence.
Absolutely. I think the biggest delay really is from the time of symptom onset to the time patients get to the hospital, and I think that's where public education is so important. I think we need to really get the word out to folks that there are these treatments available, but they need to get to the hospital right away. Most of the time when we are not able to offer this treatment or TPA, it's because patients have waited too long hoping that symptoms would improve on their own, when what the best strategy would be is to take no chances and come directly to the emergency room.
And here at St. Louis University Hospital, I'd like you to talk about our stroke program, its strengths, and the Mid-America Stroke Network, and how those two dovetail in together.
Absolutely. So we take a lot of pride in our stroke program. It's been in place for many years. We're one of the first in the region, and we've led stroke care in many different directions, and one of them was through the establishment of a large network of affiliated hospitals called the Mid-America Stroke Network that allows hospitals that have a basic level of stroke care available, but not necessarily the tertiary and quaternary resources, to connect with us rapidly and get their most sick stroke patients to the needed treatments in a timely and efficient manner. In addition to that, we have a group of trained neurologists who focus on stroke as well as critical care for stroke patients, and so that allows us to effectively treat and promote recovery in some of the biggest stroke patients. And again, that's something we've been doing for a long time. We have stroke certification through several national certifying bodies, and we always perform at very high levels on their metrics of quality. And so we've put a lot of resources into the stroke field, and we certainly want, again, to be able to offer this treatment and lead the way in showing how it can be done best and most effectively.
This guy did anything like that. So, is there anything else you definitely want to say on camera to get this in? I think you've hit the things.
Yeah, I think those will be the points. Yeah, I think we've got it.
You're very good at this, by the way.
Oh,
No,
thanks.
you were easy.
All right, well, that's good.
Okay.
I can breathe. All right, appreciate it. So you're going to be focused on this, so you're not going to be looking at my face.
I'll be wide with you.
Oh, you see the whole thing?
Yeah.
Okay. All right.
So, what is that?
Right, so this is the device which we've been discussing. It's, as I say, called a retrievable stent, and it's a cylinder, a wire mesh cylinder that's attached to a wire, and it's about the size of the spring inside a ballpoint pen, so it's very small. The way it works is we start off by making a small incision by the hip, usually, and through that small incision we enter the blood vessels of the body. We're able to guide a tube or catheter all the way up through the blood vessels into the brain arteries, and once that tube is in place, We can then slide this cylinder inside the tube, fold it up, and when it gets up to the blood clot, we release it from the tube. It opens up inside the blood clot, and the blood clot becomes trapped inside the wire mesh. After that's achieved, we can then remove that stent from the body with the blood clot attached, and using a suction device to get it all the way out and all the fragments out. And so it's very effective. It can open up the artery up to 80% of the time, and also is very safe. So we see very few adverse effects related to it.
Okay. Anything else?
No?
Okay. And by everything he said,
Go ahead and take your other hand and kind of point to it.
Okay.
Okay, put your hand on it.